A warm welcome to all of you, and thank you for joining us for yet another series of chiropractic and physiotherapy, health and wellness. Today we want to talk about scoliosis. Scoliosis is a disease that happens to afflict about 2 or 3% of the population. So in Kenya, we would round it up to about 1.5 million people. Now, in the recent past, we've been having more and more people coming in, being diagnosed for scoliosis, and it's happening amongst the adolescent population, a lot more than any other population. So joining me to discuss this is Dr. Catherine Njogu. Dr. Catherine Njogu has been a chiropractor for over 17 years, 15 of those years in the United States, and she recently came back to Kenya to continue with the practice. Welcome, Dr. Njogu.
Thank you so much, Nelly, for having me.
Thank you. Now, you've had a lot of experience with scoliosis. Let's start with what is scoliosis?
Well, scoliosis is a condition of the spine where you have an abnormal curvature to the side. When you're looking from a person's back, from the back to the front, you see an abnormal curvature side by side. That is there. And that can seem very, it can be noticeable, especially with adolescents who, when they're trying to wear clothes, it's not fitting well. It's not, their shoulders are uneven, their hips are uneven, and they see that the spine going side to side, and that can, for them, especially in that time of their life, be very, they can be very self-conscious, and maybe even that's something that even their parent may pick up and just say, well, what's with my child? Why is their body going like that, And so that can be a cause of concern for parents to then find out, well, what can we do about this particular condition they see in their children?
Okay, so coming up on the screen is different types of scoliosis in terms of where it is happening.
Yes.
So there's one where it is thoracic scoliosis. That means the curvature is at the upper back.
Yes.
What would someone be experiencing if they have this upper back scoliosis? Because I can see one shoulder is higher than the other. What would be the symptoms for this particular scoliosis?
Definitely, I think the most striking physical manifestation is definitely the unleveling of the shoulders. Mm-hmm. But with that also, too, with my experience, it has also been shortness of breathing, difficulty breathing, because of where the different nerve roots in the spine go to. So from, I'm going to use just big words, like from the first bone in the upper back and the neck, T1, through about T4, the nerves that come out of there called the cardiopulmonary nerve. That's part of the autonomic nervous system that you have no control over. And those go and supply information to, as they say, cardiopulmonary, so your heart, and also to your lungs. So when you think about how the degree and the severity of how the curvature is in the thoracic spine, that can affect primarily the lung volume capacity.
So the breathing.
And also, too, depending on how far it also goes down, it can also go into the other areas of the thoracic spine. So between T4 to about T7, T10. And now you're getting into different visceral organs of the autonomic nervous system. So, problems with the stomach, problems with the spleen, or even or the liver. And then obviously most profoundly, the diaphragm, right? So when you think about even where it affects the lungs and the diaphragm go hand in hand in terms of when the breathing, occurs. When you take a deep breath in, the diaphragm actually expands, right? And then when you breathe out, it recoils. So if the lungs are not necessarily getting much ventilation from the outside, and you have an issue with both the lungs, neurologically speaking, also too, can also affect the diaphragm as well. And that's why I see with the different lung volume capacity tests with children who have scoliosis in that part of the spine, we normally tend to see difficulty breathing, difficulty even taking a breath out completely, or even be able to even actually really ventilate their lungs.
All right. So another one I can actually see is one that is happening at the lumbar, at the lower back. Yeah, so the curve is off there.
Yes.
How would that affect someone? So I can see one hip is higher.
Yes.
How would it affect the person?
So that one is also kind of occur not only in adolescents or in children, but also too in adults. That one is a huge one for low back pain. You know, when people come with low back pain, and we do the analysis as physiotherapists and as chiropractors, we see the physical manifestation of that pelvic unleveling. Number one. So then obviously we know there's an overriding muscle chain disarray with the muscles of the lower back. Secondly, two, one of the things that I also was paying more attention to, I guess, when I was seeing many of these cases, is even most patients saying, I even have hip pain, or sometimes I even have sciatica. Okay? Because of that unleveling of the hips, because of what's happening in the lower back and the curvature there as well. Third as well, too, the different nerves also too, as well as the ones in the back that go to different organs as well. You'd have problems with irritable bowel syndrome, colitis, or even constipation, or even for women, issues with when they're cycling during their ovulation cycle, and also to their menstrual period as well.
Oh, will be irregular.
Be very irregular, number one, or they'd have severe PMS, or they'd have a severe muscle cramping because of what's happening on the ovulation cycle. Yeah.
Okay. So there's another one called thoracolumbar scoliosis. So this one actually begins at the upper back, and the curve goes all the way to the lower back.
Yes.
So I'm guessing the symptoms are combined. So you have breathing issues, you have lower back pain,
they're
hip
all
issues.
over the map. Yeah.
All right. So what about where I'm seeing one called combined scoliosis, such that the upper back, it has curved to one side, and the lower back, it has curved to the opposite side.
Yeah.
I'm guessing that is very severe. So it's a severe one, and it would cause multiple issues.
And I think most of that can be one curvature resulting because of compensations of what's happening below.
Okay. Okay.
With children,
or to try and balance out the system. So this one has curved this way, this other side curves.
And that's more like the body's writing reflexes. So the body tries to right itself by making sure that the eyes, the ears, and what they call a proprioception, which are the receptors in your muscle tissues that detect where you are in space, that they're all aligned up so that you're actually looking at, so your eyes and your ears are level with the horizon. So that writing reflex that happens mostly sometimes in the lower back will also go into the upper back to try to correct that and to try to actually be more aligned with the horizon. And typically for that combined scoliosis, especially what they call the idiopathic being, and now I'm talking about another types of scoliosis that occur in the different populations. The idiopathic, that one comes during the adolescent time when the children are actually are in their growth spurt. So the combined is going to be prevalently about 30-40% there. Many factors are concerned there, but that's what we see with patients who have the combined scoliosis. It's mostly going to be in children, in what they call the idiopathic scoliosis. Now and then you'll see that in adults as well, but not as severe as adolescents. For some reason, I don't know why it just predominates there, but it could be a local compensation that happens that way.
Okay.
Yes.
Okay. So you've actually mentioned idiopathic. So let's go into the causes or the types of scoliosis.
Yes.
What is causing this spine to curve the way it's curving?
Yes. So the types of scoliosis, because we just mentioned where the scoliosis can reside.
Yes.
Yeah. Now we're talking about the types of scoliosis that we see primarily across the map. Yeah. The first one is idiopathic, and just by that, the identifiable causes of that particular type of scoliosis is unknown because it could be many factors, but that one predominantly occurs in adolescents. So when we have children, or especially predominance in young girls, funny enough, I know the boys get a break, but the young girls normally will get this. And we see that mostly during what they call the secondary development, during that growth spurt where they actually grow in leaps and bounds. Yeah. So between age 12, 13 to about 18, 19. When a child presents with that particular scoliosis, that's when we know that's the idiopathic one. And when we tell the parents, yes, I'm glad you brought your child in to be evaluated, that's a time we spend to really commit to correcting it, because during the growth spurt, that's the best time to actually correct it. Because if it's not corrected, and this child falls off the radar, the chances are what they have after their growth plates close is what they'll have for life, and then it gets worse after that.
So the symptoms keep getting worse and worse.
And the curvatures even get worse because now you've done nothing to actually correct it.
Right.
Yeah.
So at puberty, we girls tend to want to hide what's happening.
Yeah.
Could it be one? Could it be aggravating the issue, or could it be a cause?
Well, that could be a cause, definitely. I think it's also mostly sleeping arrangements. I know we had a couple of clients who actually went to boarding schools. So when you're in boarding schools, obviously, typically, you're not going to have the best comforts that you have at home. So the mattresses are this thin. And also, depending on how long the bed is, you can have tall girls, and then someone tall, and then they have like the box at the end of the bed, and that can actually obviously cause that pelvic unleveling when they're sleeping. Okay. So combined with that and the heavy duty work that they have to do, lack of exercise, those things actually do affect teenage girls that way.
Okay. All right.
So it's one of those things that is a case by case basis. What's causing that? How did it begin? When was it detected? And how can we now fix it? Is going to be the predominant way we actually take care of the scoliosis the best that we can.
All right. So there's the idiopathic. The other type.
The other type.
Uh-huh.
The second type is congenital, and now we're talking about babies, toddlers. When during the the developmental of the child in utero happens.
And the uterus.
Yes. So as the baby is growing, and the different bones now form during that development of pregnancy. Some of the bones may not necessarily take the complete shape of the vertebra, and now you're having different vertebral, body shapes. So the baby is born with that, and that's what we call congenital. Okay. So obviously, that's rare, but that can happen. I've never seen it myself in practice, but I know that can happen.
Okay.
The third is neuromuscular scoliosis, and that typically happens with what they call a neurologic or muscular condition like muscular dystrophy or Duchenne's dystrophy, or even cerebral palsy, right? Because now you're talking about different neurological conditions that actually alter the way the muscles are actually sitting, and also a lot of muscle wasting. So that's going to obviously change the shape of the spine.
Sure.
That's more of neurologic muscular conditions. Okay. And the last one is called degenerative scoliosis. This is the one that's now more in adults, either because of the different vertebrae now undergoing degenerative joint disease processes, that either because of stress or because of injuries, and then different deformities can occur at that time.
Okay.
Yeah.
All right. So, Doctor, if I see someone with one shoulder higher than the other one, I'd be like, are we looking at scoliosis here? How do you detect scoliosis? How do you diagnose it? Yeah, and before we go there, I'd first like you to just demystify what chiropractic medicine is, so that we get into how you detect and diagnose.
Sure, absolutely.
Scoliosis, yes.
So I'll start with what I do, chiropractic medicine. It's a field of healthcare that I think is very poorly understood, but I think also because it has been, I'll be honest, has been demeaned and maligned for many years because no one really understands what it is. And also, too, it can be trivialized because, we can snap someone and then they're good. That's good, right? But really, it's more than just that. It's the understanding that how the nervous system is working is one that actually gives life to the body. So anytime you have a situation whereby you have, and we have patients who come in with all kinds of pain symptoms, issues, that kind of thing, we see is the nervous system working really well, and if not, where is it not working well and why? Okay, and with a variety of different examinations, so physical examination, neurologic, orthopedic, chiropractic examinations, plus confirming what we find in the examination with diagnostic imaging like X-rays and MRIs, then we can be able to identify the areas of what they call subluxation or misalignments in the spine that's causing the pain symptoms, that's causing the lack of range of motion, that's causing the asymmetry that we see with the shoulders and the hips, as well as the different changes in the muscle tone in the area that's been affected. So different areas of the body are going to have different textures of muscle tone, and that will tell me there's a problem there in that particular area of the spine, which then will need to be addressed and corrected with different, what they call lines of drive that are specific to restoring the alignment of that particular area of the spine. And then when you correct that, what we find is that patients not only have decreased pain, but their range of motions actually improve. Their symmetry decrease, more or less, is mitigated. And also they have more of their health back. So it's really a very much hands-on profession that is very engineering, for lack of a better word, is very based on engineering principles in the mechanics of the spine and how to restore proper mechanics in the spine.
Okay. Allow me to digress. There are a lot of YouTube videos out there. Yes. And when you meet someone and you talk about chiropractic medicine and they're thinking, oh yeah, I need to be cracked. I like it and all that. And even when you go, sometimes when you go to the gym, after the whole, workout, and the gym instructor is actually, trying to get that crack and mobilize your spine and your hips. What's your comment about what's going on?
Well, for one, I'll just say, especially I know because there's been a lot of backlash to the profession saying that we're quacks because obviously we crack everybody else and then we end up getting an injury or something bad happens, right? Well, those things, accusations against our profession are from people who are not even licensed at all as chiropractors. People, be careful who you go and get your back adjusted, because what we do is very specific in terms of our lines of drive. It's like trying to guide an airplane to land. They're going to have different vectors that the pilot needs to know to land that plane properly. If they don't know those vectors, what happens? Well, the plane crashes and people die, right?
That's for sure.
Well, that's the same principle also too.
Has to be done at a certain angle.
An angle, certain area, different positions. Those things are what we are taught in school, right? And we have to undergo rigorous training even before we graduate to actually know what we're doing, right? So I tell people, you're taking a chance going to get your back cracked by somebody who's not licensed and who has not been vetted by the authorities to have a legit bona fide background in the profession. So that's number one. Number two, in terms of the videos that are out there, granted, they're by my peers who honestly may probably want to use it as a way to get patients in, to get treated, but they don't tell you everything that happens in that video. They don't tell you, okay, we have seen this patient, we've done these examinations, we have actually been able to pinpoint the condition in terms of radiographic. Now I'm talking about x-rays or MRIs, where the condition really is, to then rule out other things that could be happening. So let's say you may have pain symptoms, and after doing an investigative consultation and discovery appointment, we determine you had some very serious conditions and some very serious accidents. Well, I'm not going to adjust you until I know what I'm looking at, right?
That's right.
And even then, you may not necessarily have a condition that I may treat. You may need an orthopedic surgeon, for all I know. So even that is not necessarily shown in that video because of the time factor. But I think also not to also overwhelm the patient or potential patients of coming in to get treated. So I tell a lot of my clients who come in, oh, I may have my back cracked. I'm like, it's not what you think it is. It's not what you see it is. And even with that, we've got many approaches or techniques to help the patient in terms of our techniques and how to address their condition. So some clients are going to have certain techniques that work for them because that's their situation and that's their condition. Okay? I'm not going to be using manual force on an 80-year-old. No.
For sure,
no. Especially when they have osteoporosis and a lot of instabilities. That's a red flag. No, I'm not going to do that.
And also the elderly.
Oh, no.
You can't use that kind of force.
No, you can't. It'll be too much. It'll be too much of a jarring, force on them, and you may end up probably even breaking bones. So I'm like, no. So really, that's why I tell people, when it comes to chiropractic, there's a lot of us who are like this. We are growing profession in Kenya. just come and make an appointment and have a consultation. Let us know whether we can help you or not. We may be able to help you. And if we can, we'll help you and we'll proceed. But if we can't, at least then you'll have a sense of what we can and cannot do, and know if that's a condition that you have that we can treat at all. So that's the chiropractic piece.
Right. So I digress. So let's go back to
I know.
scoliosis. The detection and diagnosis.
Yes.
I think we shall use a model for this.
Sure. So here we're going to talk about how we diagnose and detect for scoliosis. Okay. So I'm going to start with this particular one of our physios here called Marlon. Marlon, I'm going to have you turn with your back towards me here. So turn around. Okay. I'm going to check to see in terms of the shoulder leveling where he has a higher shoulder or another. Okay. So right here, he's higher here on his right shoulder. And also too, when I go with my hand to his back, he definitely has some curvature here in his thoracic spine. So we talked about the thoracic curvature, the scoliosis. He definitely has that, especially between his shoulder blades. So when you go down to his hips, his hip level, we find that his left hip is higher than his right hip. Okay. So I'm going to have you now turn and face the wall this way here. Okay. So if you were to look, based on what I saw, his right shoulder is higher here, okay? And if you were to look for the called abnormal curve S shape or C shape in the spine, you tend to obviously, I normally use my hands and follow the curvature, and he has a bend right there. Not much, but I can definitely feel that into his back over here. And then when you go into the level of his lower back, he definitely has what they call an increased curvature from the front to back in terms of the curvature called the lordosis here. And when you go into his lower back here, we go to the level of the hips, you can definitely see he's higher on his left hip there, okay? That's the physical examination that any parent or any of our physiotherapists or even chiropractors normally do with determining whether a client has scoliosis and where it is. The second thing I'm going to obviously talk about is doing a sign called the Adams test, and the Adams sign from the Adams test shows you where the scoliosis resides in the spine. So now I'm going to have you bend from your waistline forward as far as you can go. Okay.
My legs need to be close to
Yes, and then just go forward just like that. So here what I'm looking for is rib hump. So you can see definitely there he has rib hump right there. Okay. And whenever you have the rib hump that on one area of the back than the other, suspect that the curvature of the thoracic spine is going towards the area that's highest here. So here he has right rib hump there, right? So he has what they call a thoracic scoliosis. If we found the same to be true here in his lower back, he'd have the muscle spasms would be more pronounced here. So it'd be more of like a muscle hump here in his lower back. We see that slightly here, but not as much as we see it here in the upper back and the thoracic area here. So he does have a combined scoliosis, more so in the thoracic spine and the lumbar spine. Let's have you stand here. Yes. So the next thing we will do to actually determine the severity and the Cobb angle then is to take the x-rays, the full spine x-ray that starts from here all the way to his tailbone. And when we take the x-rays from that particular, from these areas of the spine, it'll help us appreciate the curvature of the scoliosis in the spine itself, and then measure the angles that help us know the severity of the scoliosis.
All right, so now that we have learned how to detect scoliosis in kids and adolescents and how the diagnosis is done, let's talk about treatment. Yeah. At what point does it require surgery? At what point can it be treated using physio and chiropractic? And what usually happens when it's physio and chiropractic?
Sure. So, obviously, beyond the physical examination of the patient, and also determining the severity of the scoliosis, that's now when we use the full spine X-rays. And the severity of the scoliosis will be determined by an angle of measurement in radiography called the Cobb angle. And the Cobb angle helps us to know how severe the scoliosis or the curvatures in the spine are. So between, I believe, 10 to 20 degrees, it's mild. That's definitely chiropractic physiotherapy.
That's how
much the curvature is. Yes,
okay.
a 20-degree angle.
All right.
So that's definitely managed by chiropractic and physiotherapy, and obviously with great reduction. When you get to 20 degrees to about 35, 40 degrees, that is actually moderate. And that one there obviously will require, yes, chiropractic and also to physiotherapy, but for a longer period of time because of how now the angulation has increased to that particular moderate angle.
So the treatment period will be much longer.
Much longer. And there's a commitment factor for the patient and the family to actually stick with it.
So what are we looking at? A year? 10 years?
I would definitely say anywhere from 4 months to about 7-8 months because of the severity of the angle, the Cobb angle. Above 40, 50 degrees, that becomes a condition and a situation whereby, you'd have to start looking at surgery because of the degree of curvature that is there, the implications of what that curvature is doing in terms of how different organs are functioning, like your lungs and your heart and different other things as well, but also to how fast it got there, That's why when we actually take the x-rays first of the client to determine how severe it is, most parents would not want, obviously, to have their children under a knife, go for surgery.
Yeah.
So when we have clients who actually say, no, I want my child to actually just do the best that we can, say, okay, we'll do what we can, but it will require serious commitment, right? Because even as we're treating the client and the patient, we'll be taking what they call progress x-rays to see what if we're doing anything to help change the curvature of the scoliosis. So can we decrease that Cobb angle? But at the same time, in the back of our minds, we recognize that this could also be a surgical consultation because of, number one, if that patient is in their growth spurt, if nothing's done to stop that particular scoliosis at that severe degree angle, it will just get worse, right? And then secondly, too, in terms of commitment, and this is where now we talk about having the client and the parents agree that they have to take their child out of school to get treated, and that can be hard, right? Because you have children who are either in boarding school, and also to the time factor and commitment, taking the child for physio and chiropractic treatment. Also, what she needs to do, is there bracing to be done at home? What exercise does she have to do outside of our treatment times? So that's going to be a very strict and very mentally, you have to be mentally prepared for that. And even there are no certain guarantees that will fix it, because obviously that will depend on those other factors that we cannot control as physicians. But we do the best that we can to then see, okay, if we can even reduce it even to about 10, 13 degrees, from either 50 to 35, 36, that's better than nothing, right?
And life can be as near normal as...
Exactly, as near as normal, but there has to be a commitment to the treatment itself, because that's the reality, that's what you present with, and the key thing is detecting the scoliosis earlier before it gets to that progression. As we just showed, this is what our parents can do at home to detect it in their children as young as 5, 6, 7 years old, and then still bring them in, even if it's not gotten there. Still bring your child in for treatment and for physio and chiropractic, because if you can actually prevent a problem from happening, that's better than trying to fix it when it's already there.
Okay, Doctor, I'm a bit curious.
Yeah.
So I get scoliosis. Say it's about 15 degrees, and say it's at the upper back.
Yeah.
So what exactly does physio do at the upper back, and what exactly does chiropractic do to bring the spine back into position? Yes. What are the mechanics here? What's going on?
So for us, we are trying to do what they call corrective. So chiropractic is more corrective treatment to try to help correct the misalignments and bring the spine back to alignment as much as possible with the different lines of drives, right? The physio will take care now of the muscle imbalance because of the misalignments.
So the muscle imbalance
so they both work very well hand in hand.
Okay.
Yeah, and of course, like we just said, the lesser the Cobb angle, curvature and the severity of, the lesser the severity, the easier it is to actually fix that problem when it's still very minimal, right? It's going to not take as much effort and it won't take as much time to correct that. That will resolve obviously a lot more faster than a curvature that's either 30 or 45 degrees.
Okay.
Yeah.
So if today I come in and it's at 10 degrees and say I decide, you know what, I won't get treatment now, and say a year down the line, things get worse, and I come in and you tell me it's at 20 degrees, what could have been the aggravating factors over and above? Say it's not idiopathic. What could have been the aggravating factors?
So when it's not idiopathic, now you're talking about degenerative, right?
Okay.
So extreme sports, activity, accidents, injuries, those things that are there, not even exercising, not stretching, those things, as much as I know we tell patients to do them and we do them, when you have that happening, then you start talking about, okay, as we age, the body undergoes more wear and tear, right? And when you have a condition that's very minimal in the beginning, and you just shrug it off and you say, well, I don't have pain, so I'm not going to come in and get treated. But then now you have severe pain, and now things have gotten really bad because they've undergone out of wear and tear. That's when we tell patients, it's better to fix an issue when it's still very minimal, than coming back to us with a lot of pain, and things have gone from bad to worse. So, that's when we really advocate and tell clients, depending on your severity, on your, what they call your perception to pain, if you have a very low tolerance to pain, that's when patients come and see us. And the issues are minimal in terms of how we objectively see them, but they're able to get the care that they need and fix that. But patients who are the majority, who have a high pain tolerance, and they come in only when it's severely painful, and I've seen that like 90% of my clients, and I'm like, your perception of pain is such that it takes a lot for you to actually get a lot of wear and tear. So to those kind of clients, I tell them, look, if you're even getting some kind of discomfort, minimal discomfort, just come and get treated, because by the time pain checks in for you, a lot of damage has happened. And at some point, I'm like, you may need more care, and more care equals, of course, more of a financial commitment. So I tell them, either you pay now, you pay later.
Or a lot of us are actually sitting on pain.
I
don't actually think it's a high tolerance for pain.
Yeah.
We're just sitting on it.
Exactly.
And we'd rather pop pills.
Yeah. And the thing is, though, the popping pills is symptom care.
Yes.
It's not getting to the root problem or the root cause of your issue. So you cannot take so many pain pills, and then your body has to adapt to it, and then it goes from that to worse. And by the time you come to us, it may be too late. We can't even help you. I had a client in her 80s who came to see me, and her spine has what they call a degenerative scoliosis, as in her low back bones were shaped like pizza slices, and she had a disintegrating spine. She had no discs, and I was just left like, and you didn't come for chiropractic care in your entire lifetime, and you're here in one of the wealthiest countries in the world. He's like, I was afraid of chiropractic, but I'm not like, but you have been taking so many painkillers, so many corticosteroid injections, to the point even now medical doctors are like, we can't help you because you have a disintegrating spine. So I told her, hey, what I can do for you is we can try to at least stop and halt what you have at your age, increase movement, and have no pain, or at least be pain-free. I said that's what I can do at your age with where you are. So don't get to 80 and then you have the condition as my client had.
Wow. Okay.
So it can get worse.
It can get really, really bad.
Yeah.
All right. So any last words for our audience? What would you like them to know about scoliosis, or
Yes. So I think the biggest thing is being more self-aware. I know as far as many of our clients who come to see us who are either very fit and physically fit, they go to yoga, they go to Pilates, they exercise. Those are the ones who actually are more aware of their bodies and they're more aware of, okay, I'm not sitting well in my shoulders and my hips, and my back is all kind of weird. And they're more likely to come and get themselves evaluated and have a consultation with us, whether with a physiotherapist or with a chiropractor. We can learn a lot from those kind of clients who actually are physically fit and who are trying to take care of themselves, but you don't have to be that way to actually even know that you have an issue. So I just say, definitely pay attention to how you're looking at yourself in the mirror. Check to see, are my shoulders equally sitting equally? Is there one area that's higher, one shoulder is higher than another? My hips, are my hips square? Are they, is there that imbalance? And also just pay attention to how how you're wearing your clothes, because sometimes when you wear clothes, you can see that some areas don't fit well.
Yes.
You can even see that there's been a rotation in the spine. Okay. That can happen. Then it can tell you that's also another key factor for scoliosis. Besides the shoulder leveling, you could have rotation in the shoulders, in the chest, and in the lower back and the hips. So look for those things. If you want someone to help you, verify that, like a family member or a friend or a spouse, let them do that too as well. And then just get yourself here at any of our 3 clinics and get evaluated by a physiotherapist or a chiropractor, because honestly, you don't want to get the point of you can't even walk or can't really breathe or can't do much, and then you come and see us at the last minute. And we can definitely help those situations when they're caught earlier. And with parents, definitely check your children, as we showed you right over here. Check and see if your child or your children have that curvature, or they have that rotation, if the clothes that they're wearing are sitting well on them, are they wearing them properly? Because that's going to be really key in helping number one, to detect scoliosis when it's still very minimal, and then getting that obviously, corrected before it gets worse. And then obviously now we're talking about more time, commitment, and also to finances as well.
Okay.
Yes.
All right. Mm-hmm. So there you have it, folks. What is scoliosis? The areas of the spine that it affects and how to detect it early, and the treatment options. I have been your host. My name is Nelly Ndiga. Do have a good evening.